This podcast is sponsored by Talkspace.
Last year, I went through many different life changes. I needed to take a pause and examine how I was feeling in the inside to better show up for the ones who need me to be my best version of myself.
When you're navigating life's changes, Talkspace can help. Talkspace is the #1 rated online therapy, bringing you professional support from licensed therapists and psychiatry providers that you can access anytime, anywhere.
Living a busy life, navigating a long-distance relationship, becoming a first-step father, Talkspace made all of those journeys possible. I could speak with my therapist in the office. I could speak with my therapist in the comfort of my home. I was never alone.
Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance, no problem. Now get $80 off your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, kidney stones are on the rise, but research is falling behind.
Despite it being a common condition that causes an incredible amount of pain, discomfort, and morbidity, we haven't had any real novel developments in decades.
But first, addressing childhood sexual abuse and prevention strategies.
Kids are assaulted by people who they know. Child predators succeed because they come across as great guys.
All that and more this week on In Good Health.
Hey, Sal.
Hank, what's going on? We haven't worked a case in years.
I just bought my car at Carvana, and it was so easy. Too easy.
Think something's up?
You tell me. They got thousands of options. Found a great car at a great price. And it got delivered the next day.
It sounds like Carvana just makes it easy to buy your car, Hank.
Yeah, you're right. Case closed.
Buy your car today on
Carvana.
Delivery fees may apply.
My name's Mackenzie, and I started a GoFundMe for the adoptive mother of a nonverbal autistic child. The mother had lost her job because she wasn't able to find adequate care for this autistic child. So she really needed some help with living expenses, paying some back bills. So I launched a GoFundMe to help support them during this crisis. And we raised about $10,000 within just a couple of months. I think that the surprising thing was by telling a clear story and just really being very clear about what we needed, we had some really generous donations from people who were really moved by the situation that this family was struggling with.
GoFundMe is the world's #1 fundraising platform trusted by over 200 million people. Start your GoFundMe today at GoFundMe.com. That's GoFundMe.com. GoFundMe.com. This podcast is supported by GoFundMe.
It's a sad reality that doctors who work in pediatric emergency medicine will frequently see children who have been sexually abused. The Rape, Abuse, and Incest National Network reports that 1 in 9 girls and 1 in 20 boys experience sexual abuse. Other estimates are even higher. Some of these children may even be toddlers or infants.
Sexual abuse is overwhelmingly the most common really bad thing that happens to children, physically or socially. And how they come into the ER can look like different things. So sometimes children present to the ER in the context of an acute assault. But then additionally, not surprisingly, children who have experienced a history of childhood sexual abuse disproportionately experience depression, anxiety, post-traumatic stress disorder, physical ailments related to stress. And so we see kids for those reasons as well.
That's Dr. Bronwen Carroll, a pediatric emergency medicine physician at Boston Medical Center and assistant professor of pediatrics at Boston University. She says abusers are most commonly people the child knows, a family friend or relative, a teacher, coach, babysitter, and sadly, sometimes a parent. Carol says it's rarely the creepy guy in the van asking if you want to see a cute puppy.
Kids are assaulted by people who they know. Child predators succeed because they blend in, they come across as great guys. I always tell parents, the greatest risk to your child may very well be the nicest guy you know. It is the favorite teacher, the trusted coach, the beloved member of the clergy. And the reason why childhood sexual abuse has remained so pervasive is because child predators are really good at what they do. That's the bad news. The good news is child predators are like a football team who keeps winning with a single play. And for whatever reason, it seems that nobody has been watching the tapes or paying attention, but their behavior is entirely predictable. And so if we can teach families and we can teach kids to recognize and defend the play, we can change this problem.
In order for a child predator to succeed in their goal, Carroll says they need 3 things: access, compliance, and secrecy.
The way in which we need to be combating sexual abuse is a 3-prong approach to block predators at each of these stages. So in terms of access to a child whom they perceive as vulnerable, parents and other primary caregivers of children need to be aware of who has private access to their kids. So child predators almost always sexually assault kids either in the child's home or in their own home. And so parents just need to be aware of who has access with their kids. And parents need to make themselves visible because we know that child predators seek out children whom they perceive to have low parental involvement.
Carroll clarifies that being involved doesn't mean you have to turn into a helicopter parent. As a working mom with 4 young kids herself, she knows that's impractical.
I am certainly not attending every lesson, every practice, volunteering at every event at the school, but I make sure I drop in on the babysitter. I introduce myself to the coach. I make sure that I have contact with the teacher so that the adults who my kids are interacting know this child has a parent who's paying attention.
Child predators often take the path of least resistance, which means that if there's a watchful parent, the threat of getting caught becomes greater than they're willing to risk. The second part of the abuser's mission is compliance, getting the kids to trust them and follow orders without pushback. They achieve this through grooming.
The way that this generally goes is child predators don't assault children out of nowhere. There is a grooming process through which predators test kids to see how they're going to react. And so by preparing children so that they know what to look out for and they know what to do if it happens, we can make our children kids who fail predators' tests. So you want your children to know. Adults should not be seeking out kids and treating them differently. If the teacher gives the whole class a prize or brings something special for everyone, that's great. But adults should not be singling kids out for special privileges, special treats, private things that other kids aren't doing. Is that always a problem? No, of course not. It could be completely benign, but it's a warning sign, and your kid should know if that happens, you want to know about it.
Furthermore, adults should not be talking to kids about sex outside of health class or a doctor's office.
And the reason why is because child predators desensitize children to both sexual material and touch. They try to normalize it. So they start with benign touch, right? It just starts with a pat on the back, a back rub, an arm around the shoulder. All of those things can be completely warm, caring, loving, normal. They're not necessarily a problem, but then it progresses from there. So parents should tell their children, if an adult seems to be touching you more than you would expect, even if then they pretend it's an accident, or if an adult is ever showing you sexual material, talking to you about sex, making dirty jokes, those are not normal behaviors, and you should talk to us about it.
The third element child abusers consistently rely on to succeed in harming children is secrecy.
The simplest message that we can give kids is adults never ask children to keep secrets. A secret is different from a surprise. A surprise is making grandma cupcakes for her birthday. With a surprise, the person ultimately finds out, and you anticipate that the person will be happy about it. Secrets are different. With secrets, nobody is ever supposed to find out, and presumably if they did, they would not be happy. So by teaching children, adults do not ask kids to keep secrets. And the beauty of this message is a preschooler can understand it, but it still applies in high school. That is an excellent and simple way to get ahead of predators.
But this knowledge can only work if it's put into practice. Many parents may have a hard time figuring out how to approach this topic with their kids. It can seem scary and inappropriate for young children, But Carroll says not to fear. Parents don't need to get into the nitty-gritty details. Instead, they can frame the conversation in the context of other safety issues that kids are accustomed to hearing. For example,
just like I make you wear a seatbelt, even though I don't expect us to get into a car accident. And just like we have a fire extinguisher in our house, even though I'm not expecting a fire. I want to talk to you about another safety concern, which is adults who have problems in their head and whose brains aren't working properly, so that for reasons that we don't really understand, they want to have inappropriate relationships with children. So these are things that if they ever happen, I want you to tell me about. Maybe it's a sign of a problem, maybe it's not. We'll figure that out together. What I want you to know is I will believe you, I will protect you, I will keep you safe. And then you go through some of the grooming behaviors. If somebody's touching you, if somebody's giving you special privileges, if somebody's telling you to keep secrets, if somebody's showing you sexual material, all those things, we should talk about that.
Carroll acknowledges that unfortunately some kids will fall through the cracks. This may happen when the abuser is a family member, for example, and the parent is in denial and doesn't want to believe their child.
I wish we were operating in a perfect world with perfect circumstances, and of course we're not. My hope is that if we can finally end the cultural shame and secrecy around this whole topic, so this just becomes part of standard childhood injury prevention, just like car seats, just like bike helmets, then kids will hear this messaging from multiple places. They should be hearing it from teachers, through schools, from other relatives, so that hopefully, if a child is being abused by a family member, which happens more frequently than any of us want to think, that child will still get the messaging from other places and know that they can confide in a pediatrician, a teenager, an aunt, a cousin, another relative whom they have a relationship with.
And as we ask children to trust adults, we need to make sure adults are aware of the role they play. Research shows that children rarely lie about being sexually abused, so it's important for adults to take what they're saying seriously. And by making this topic approachable and part of an open discussion, it helps create what Carroll calls conversational scaffolding.
And what conversational scaffolding is it enables people to return to something. It's structure, just like real structure. It's real structure that provides support and provides protection, just like actual scaffolding. And the reason why this is important is because if a family has never had any conversation on any of these topics, and something is happening to a kid that they feel uncomfortable about, it is quite unrealistic to expect that the child out of nowhere is going to find the words and know how and know when to disclose to a parent. However, if you have had a conversation about this in the past, then you've set up scaffolding. And the reason why that's helpful is because then a child can say, hey, Dad, hey, Mom, do you remember how you talked to me once about grown-ups who maybe seem like they're touching you too much? I think that might be happening to me at school.
Experts estimate that there are 42 million adults living in the U.S. today that have experienced childhood sexual abuse. When Carroll is speaking about prevention around the country, she says that invariably someone will approach her and quietly share their story.
Because it is so common, everybody has some version of a story. That is in some ways the bad news, but I also view it as the good news, because I believe that so the estimate is that there are at least 42 million adults who experience childhood sexual abuse living in the United States today, which means that there are at minimum 42 million people who know how real and devastating this is. And I think people are ready for change. I think people are ready to start these conversations and change the culture.
Carroll is currently writing a book about childhood sexual abuse prevention, hoping to help normalize these conversations and end childhood abuse. You can find more information about Dr. Bronwen Carroll and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.
Coming up, why are young girls becoming more vulnerable to kidney stones? When In Good Health returns.
Reggie, I just sold my car online.
Let's go, Grandpa. Wait, you did?
Yep, on Carvana. Just put in the license plate, answered a few questions, got an offer in minutes. Easier than setting up that new digital picture frame.
You don't say.
Yeah, they're even picking it up tomorrow. Talk about fast.
Wow, way to go. So, about that picture frame.
Forget about it. Until Carvana makes one, I'm not interested.
Car selling made easy. On
Carvana.
Pickup fees may apply.
My name's Mackenzie, and I started a GoFundMe for the adoptive mother of a nonverbal autistic child. The mother had lost her job because she wasn't able to find adequate care for this autistic child. So she really needed some help with living expenses, paying some back bills. So I launched a GoFundMe to help support them during this crisis. And we raised about $10,000 within just a couple of months. I think that the surprising thing was by telling a clear story and just really being very clear about what we needed, we had some really generous donations from people who were really moved by the situation that this family was struggling with.
GoFundMe is the world's #1 fundraising platform trusted by over 200 million people. Start your GoFundMe today at GoFundMe.com. That's GoFundMe.com. GoFundMe.com. This podcast is supported by GoFundMe.
Kidney stones have been around for centuries. In fact, the condition was first mentioned in medical texts dating back to around 3200 BC. The stones are hard deposits of minerals and salt that have crystallized inside the kidneys. However, Dr. Greg Tashin, an attending pediatric urologist at Children's Hospital of Philadelphia, says while many people focus on the stones as the issue, they're really just a symptom of a bigger problem.
They're a disorder in the way that your body handles minerals. And when you think about it like that, you can understand that you're at risk for these recurrent, painful, episodic events. But it's also important to recognize that there are so many other factors or health consequences that come with stones, such as an increased risk of kidney damage or chronic kidney disease, heart disease, high blood pressure, and even an increased risk of death with recurrent stones.
There's many factors that could cause stones. Your diet, environment, fluid intake, and more can all contribute to the crystallization. They can go unnoticed in your kidneys for years, but the painful symptoms will start if a stone breaks off and travels into the ureter, which is the tube connecting the kidneys to the bladder. That's when you'll feel the extreme pain and nausea often associated with this condition. And though kidney stones have historically affected middle-aged men, an unlikely demographic has been seeing a steady rise in cases over the last few decades.
Although stones affect about 11% of the people in the United States, it was once a rare condition in childhood, but now is increasing. And with that, there are, number one, an increased number of children who have stones, but the evidence that's used to support decisions of how to treat those children is far weaker than it is for adults because it was once a rare disease and now no longer is.
So while more and more children are being affected, research is still trying to catch up. Unfortunately, the tides have shifted even more drastically than just age-wise. The rise in cases has had the greatest impact on young girls, a population that's already proven to have a historical lack of research.
Historically, it's about 3 men to every 1 woman who would get stones. Now, in younger individuals before 25 or 26, it's about 60% women or adolescent girls and 40% boys. So something has shifted really dramatically over a short period of time. It's not the genetics that are changing. Nothing changes in society that quickly in terms of genetic susceptibility. But I think our exposome has changed so much. All of the environmental factors to which we're exposed has changed dramatically.
For example, the FDA reports that most Americans consume much more sodium than the recommended daily amount, which is about 1 teaspoon of table salt. However, Tashin doesn't believe that it's the only factor to blame. It could help explain the overall rise in kidney stones, but not the gender bias. His research team has been focused on finding the why to this phenomenon so that they can develop new and effective treatments. The current treatment process usually starts with understanding why the patient developed stones in the first place so that they can be prevented in the future.
It begins with an understanding of what other medical conditions might be contributing to stones and how those might be optimized. But then it also includes simple blood tests to look for signs of incredibly rare but important to recognize genetic disorders. And the cornerstone of the evaluation for any patient with stones is a collection of the urine to look for those chemistries, those minerals in the urine that, if they are out of balance, can increase the risk of stone formation.
The urine test is done at home, and though it's an extensive, all-day process, it can provide a lot of insight into what nutrients your body isn't able to process normally. But even if every patient took this test, some cases would still slip through the cracks.
About 40% of children have normal urine chemistries, meaning when you do that 24-hour urine test, everything looks fairly normal. They may have a low fluid intake, their urine volume may be low, but there aren't any of those fundamental differences in calcium or citrate or other minerals in the urine. And that's where I think we are really focusing on understanding what else is going on upstream, perhaps of the urine itself, that could be causing these stones to form.
Tashin thinks the answers could lie in the patient's microbiome and digestion process. Specifically, he thinks a cause of the stones could stem from a disruption in the gut microbiome.
We know that children who have taken antibiotics are at increased risk of stone formation, and that these individuals, especially earlier in life, have this disruption of the gut microbiome, and that may affect how one handles the nutrients, either taken in through diet or as part of your normal, what we call the gut-kidney axis, that connection between the gut and the kidney, and then how that could impact the risk of stones forming.
And though antibiotics are great at fighting off infections, research has shown that they can disturb the gut microbiome for 6 months to a year. The balance of microbes inside your gut is essential for maintaining your health, so the imbalance that antibiotics create could increase the risk of developing kidney stones.
I'm not saying in any way that it's the antibiotics alone, but that could be one factor that we're seeing more commonly now than 30 years ago. We know that overall in the United States, the groups of individuals who are exposed to antibiotics the most, and especially unnecessarily or inappropriately, are children and women. That may be completely ecological fallacy, that we're seeing trends going in the same direction. They're not causal, but it does cause at least one to pause and consider what could be contributing to this.
While we wait for research to unravel these mysteries, Tashin still has to treat his adolescent patients who are currently being affected. He says surgery is the typical treatment option. However, that approach may change when the patient is a child.
For example, some of the surgeries that are performed for stones are more challenging to perform in small children because of the size of the ureter. So what might be one procedure for an adult could be up to 3 for a child. And that means 3 anesthetics, the discomfort of surgery 3 times, the risks of radiation. So all of those are factors in the decision-making that would vary from a child compared to an adult.
But once the stones are removed, prevention methods like dietary and lifestyle changes become the main focus. The challenge is that each new patient requires a different approach.
I really consider this like a puzzle. So each bit of information is a piece of the puzzle. And one of the key pieces is, what is the stone made out of? What's the composition? The other pieces are, what do the lab tests show? What do the urine studies show? What are the genetics? And then as you put these pieces together, a picture emerges. And that picture will be different for every patient, for every child. And then it's tailoring the treatment based on that individual risk and really what those priorities are from the patient.
Some families will choose to limit or avoid medication altogether because of the potential long-term effects and solely focus on dietary management. Other families will rely on medication for a short time period to focus on preventing new stones from forming. Hopefully, these families will one day have the novel treatments that Tashin's group and many others are working on today.
Ideally, we want to be able to develop a probiotic that you can take this yogurt, and that would restore that healthy balance in your gut and decrease, stone formation. That's the holy grail. It's going to take a long time to get there, but with our patients participating in our research and that partnership, I think that's a goal that we can achieve.
You can find more information about Dr. Greg Tashin and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. This segment originally aired in February 2024. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Medical notes this week. The tides may finally be turning on veteran suicide. New research in JAMA Network Open highlights a significant decline in suicide rates after nearly 20 years of steady increases. This shift suggests that prevention efforts, including improved mental health access and firearm safety programs, are successfully saving lives across the country. However, researchers are still unsure which specific programs are having the biggest impact and hope to understand the driving force soon so that more resources can be focused in those areas. A new treatment for seizures may soon be possible without the need for invasive brain surgery. A study published in ACS Chemical Neuroscience details a non-surgical method that uses focused ultrasound to reach areas of the brain responsible for epilepsy. By targeting these specific neural circuits, researchers were able to suppress seizure activity in animal models. This breakthrough offers a potential lifeline for the millions of patients whose seizures do not respond to the traditional medication, but who are hesitant to undergo traditional surgery. When it comes to inducing labor, success may be all in the timing. According to research published in Molecular Metabolism, the standard one-size-fits-all approach to starting oxytocin may not be the most effective strategy for every mother. The study found that waiting until the cervix has reached a certain level of natural dilation before starting the hormone can significantly reduce the risk of emergency C-sections and other birth complications. And finally, the stigma surrounding mental health on campus is fading. According to the Healthy Minds study, the mental health of college students is improving and more are seeking out professional help. While the volume of students reporting symptoms remains high, researchers found that this uptick in service use is a positive sign that younger generations are more proactive about their psychological well-being. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.